Hi everyone, this is Justina and I'm from Shanghai, China. And today I want to share with you about my project on child health disparities in ethnic minority regions of China. In urban areas of the country, there's a very well-established healthcare system. Insurance covers most of our needs and our hospitals are nearby. Also, we have wide access to vaccines. However, in more remote areas, hospitals are far away and resources are limited. People lack of proper information of medical care, especially for vaccines. And these gaps create health disparities for children growing up in different regions in China. Before I discuss my findings, I want to explain my motivation behind this research project. After experiencing COVID-19, I gained a strong understanding of just how important it is to have a strong healthcare system. And this drove me to explore about more diseases and public health challenges in China. And one particular disease that stands out to me is Streptococcus pneumoniae. So this is a common but serious illness that affects many children in remote areas. And my objective with this project is to raise broader awareness of these healthcare disparities in China, and most importantly, explain why they needed to be addressed. To better understand these disparities, my research compared two different regions of China: Shenzhen, a highly developed city in Guangdong province, and Tongren, a remote and underdeveloped city in Guizhou province. One major difference between these areas is in how people treat illness. So as you can see in this graph, in Tongren, nearly half of the households rely on antibiotics. This is because antibiotics are cheaper and also they are mostly covered in insurance. However, far fewer families in Shenzhen use antibiotics when sick. There is an even clearer difference between these two different places when coming to vaccination rate. So, more children in Shenzhen are vaccinated compared to those in Tongren. These differences are related to socioeconomic status. In Tongren, about half of the people are classified as low socioeconomic status, meaning many families face financial struggles. However, in Shenzhen, most families are classified as high socioeconomic status, which means that they are more educated and also they have a better quality of life. And these inequalities shape how people in different communities view antibiotics and vaccines, leaving children in poor regions more vulnerable toward diseases such as Streptococcus pneumoniae. And the first and most important step of this change is to raise awareness about vaccination. So during my fieldwork last year in Guizhou, I learned that people who live there have little knowledge about vaccines, and some of them even believe that vaccines are harmful. So instead, they relied on antibiotics when illness comes. To change this, we need to start by building a proper dialogue. We can do this by talking about their family life, about daily lives, about their health status, and even sometimes their financial concerns. To build a trusted relationship, and through these conversations, these families may feel comfortable to talk with us, and we can teach them that vaccines are not harmful, but actually protect children from serious diseases. Even though addressing the health disparity takes time, small steps like building awareness and providing education are feasible and cost-effective solutions, and they can help to change the preconceived notions people have and improve child health outcomes in underdeveloped regions. Change is something that begins with awareness but can only grow with actions. Together, we can make this change. Thank you for listening.